What is anxiety? The psychiatric definition of anxiety is, quote, a nervous disorder characterized by a state of excessive uneasiness and apprehension, typically with compulsive behavior or panic attacks. Generalized anxiety disorder is the most common anxiety that one can be diagnosed with. It creates anxiety over issues that others would find to be a minor day to day task. There are both physical and mental symptoms of GAD. Other anxiety disorders include panic disorder, which means you have regular panic attacks with no particular trigger. Social anxiety disorder, which means you get panic attacks or severe anxiety from being in public places, whether it is in front of a large or small crowd or just a few people. Health anxiety is when you constantly are fearing that you have an illness or that you are going to have a medical emergency. Phobias are fears of specific objects, places, people, things, situations, etc. There are a lot more different anxiety disorders that I was not able to list. There is an estimated 275 million people around the world that suffer from anxiety. There is a difference between having anxiety and being anxious. That difference is that being diagnosed with anxiety disorder causes constant, elongated panic over things some people wouldn't usually get anxiety from, whereas feeling anxiety or feeling anxious is a short-term feeling of stress in a stressful situation.
So, for people that deal with anxiety disorders, there are many different treatment options that they can use to help cope better. Overall, for anxiety disorders, it is best to be treated with either some type of psychological therapy, pharmacotherapy, which is medication, or in some cases both. But again, these treatment options differ based on the patient and their type of anxiety disorder that they're dealing with. Overall, some different types of treatment types include self-treatment, such as meditation, exercise, stress management. There's counseling, such as psychotherapy, cognitive behavioral therapy, or there's medication, and some types of medications include Triclix or benzodiazepines. So, when thinking specifically about therapy, the main type of therapy, well, at least like the most well known and widely used, is cognitive behavioral therapy or CBT. So, CBT is based on the fact that what a patient thinks or what a person thinks will affect how they live. So if you live your life and you have negative thoughts about your situation or what's going on around you, that's going to affect how you feel and it's going to affect your behavior. It's going to make you feel more sad. It's going to make you feel more anxious if you are thinking more negatively. CBT is used to help people figure out where these negative thoughts are coming from and help replace them with more realistic and positive thoughts in an effort to help cope better. Another type of therapy is exposure therapy. Exposure therapy is used for people who deal with anxiety in general, but it is specifically used in some cases more than others for those that have phobias. And the best way to overcome some phobias is just to face it head on in some cases. So that's why exposure therapy is used. Exposure therapy usually contains 3 steps. First being relaxation, which is when a therapist would usually give the patient techniques on how to relax and help counter some of this anxiety that they're feeling. Then the patient will go on to create a list, and this list will include some things that will trigger them when it comes to their phobias. And then it'll lead to expose is the third step, which is going through this list of triggers and facing them, and at the same time using the relaxation techniques that a therapist gave you to help cope with this. And then other types of therapy include art therapy, music therapy, and dialectical behavioral therapy, or DBT. Lastly, when talking about medication, there's many different types of medications that those who deal with anxiety disorders can take. Two that I'll be talking about are benzodiazepines and antidepressants. So benzodiazepines are types of medications that help you relax your muscles and calm yourself. They're usually meant for short-term treatment, not long-term treatment. And this type of medication helps people that deal with generalized anxiety disorder, social anxiety disorder, and panic disorder. Some examples include Valium, Xanax, and Ativan. And then there are antidepressants. These are used to help people, who deal with depression, but it also can help treat anxiety. A common type of antidepressant is called selective serotonin reuptake inhibitors, or SSRI, And these types of medications increase the amount of serotonin that you receive, so they just increase the serotonin levels. And then another thing is with antidepressants, this is meant for more long-term treatment because it does take about 4 to 6 weeks to even um, see like any results in some cases. But some examples include Zoloft, Prozac, and Lexapro. So overall, there are many different types of treatment for those that deal with anxiety, but some of the main ones include medication and therapy.
All right, so these are the causes and symptoms of anxiety. Ignore my voice right now. I lost it, so it kind of sounds annoying, but some symptoms of anxiety include cold or sweaty hands, dry mouth, nausea, heart palpitations, trouble sleeping, can't really stay calm, running out of breath, having panic or nightmares or flashbacks of sorts. And it's not just limited to these symptoms, but I would say these are some of the more common ones. But there are a lot of symptoms of anxiety that somebody could have. And then it could be caused by chemical brain imbalances, which are a result of long term stress, or hereditary factors. So, anxiety can be passed down from parent to kid, from family to family. And then just general trauma. These could all be causes. And then for the diagnosis aspect, if somebody were to just go to a regular doctor, the doctor would perform a physical exam and then ask about any symptoms or their general medical history. And there's no specific lab test or scan that is made for anxiety that's like, oh yeah, if this happens, then they definitely have anxiety, because it's really a mental thing. It's not really so physical. There's no test that can just magically tell you if somebody has anxiety or not. So if the doctor doesn't find any physical illnesses that could lead or be a result of a different medical condition that they could diagnose, then they suggest that the patient goes to a psychologist or psychiatrist. And what these doctors do is they have a specifically designed interview and specific assessment tools, along with the DSM 5, which is basically specific criteria for each mental illness with specific guidelines that would help a doctor or psychologist diagnose somebody correctly.
All right, so today we're going to talk about the common stereotypes of anxiety. Going through things really quickly, my group and I already discussed stereotypes we might think are true about anxiety, such as anxiety stemming from trauma. But according to mental health counselor Grace Sue, your anxiety can be simply triggered by having too much to do, routine changes, or even watching the news. So anxiety doesn't necessarily have to come from some past event that has spiraled out of control. It can really come from anything. So the reason for that may be that your past traumatic events, it is something that you or your mental health professional can discover together during your treatment process to identify why you're triggered. The other thing about anxiety that some people might think is that it makes you weak. Anxiety may make someone feel vulnerable, weak, or like a burden to their family, but with such a large portion of the population having an anxiety spectrum diagnosis, it can't really be that simple. And then the other stereotype would be that it's incredibly uncommon. Over 40 million adults in the US, that's 19.1% of the population, have an anxiety disorder. Approximately 7% of children aged 3 to 17 experience issues with anxiety each year, and most people develop symptoms of anxiety before the age of 21. Stereotypes about what anxiety is like can also be misconstrued. So often we think of people having extreme anxiety or anxiety attacks by having sweaty palms, hyperventilating, tremors, blurred vision, pinhole vision, or other physical reactions. And although these symptoms are true for some, they're not true for everyone. Anxiety shows itself in a variety of different ways for many different people, and it's important to remember that going forward. So peers, mentors, and family members need to remember that anxiety comes in a variety of different ways, and not to diminish the experiences of those around them because their version of anxiety may not look like what they perceive anxiety to be.
There are many ways available to raise awareness about anxiety. Earlier we talked about the stigma and stereotypes around anxiety. So now these are ways to raise awareness about anxiety. One method is through social media. Social media enables us to be able to reach a larger audience than ever before, as well as reach even further audiences. You don't need to leave your house to create a following on social media, so informing others how anxiety has impacted you and your loved ones can help so many other people feel comfortable and informed on the subject. The internet and social media also allows others who are struggling with anxiety to come together and talk about their experience. This allows them to cope better with their own anxiety and feel safe to discuss some of the things they're going through. School programs are another good way to raise awareness about anxiety. Schools and hold club meetings and assemblies informing students on what anxiety is and how to get help. Guidance counselors and teachers can also have ways to get help hanging up in their classrooms and listing out resources for students who are struggling. Another way to raise awareness for anxiety is through public events. Public events can be used to help inform people about anxiety and the daily struggle people who have anxiety go through. This can be used to inform loved ones on how to help someone struggling, as well as connect people who are currently struggling with anxiety. Connecting with people going through the same thing as you can help make you feel less in the dark and less alone. It's important to speak up about what you're going through mentally and physically. Identifying these stressors and realizing you're struggling is the first step to getting the help you need and deserve. Some ways to support yourself and others while struggling with anxiety are encourage kind language with yourself. So make sure you're not too hard on yourself and giving yourself breaks during the day. And just in general, being kind to others because you never know what someone is going through. Talking about your own experiences with someone who is close to you can help begin the conversation about getting help or even feel good to get what you've been dealing with off your chest. Anxiety is difficult to deal with on your own, so the first step is simply just talking it out with someone. Educate yourself and others. Many people don't know what to do when they are experiencing extreme anxiety, since everything feels so much harder to do. Simple tasks are extremely anxiety inducing, making daily life almost impossible sometimes, so educating yourself and loved one on ways to help you and yourself can go a long way when overcoming anxiety. Social media breaks are good for your mental health. Social media displays a very different picture than what is actually going on behind the scenes. But when you are struggling with something so debilitating, you see all these people, and it's hard to believe they could also be going through something similar. Taking a break from social media can lessen your comparison with yourself and others, leading to a mentally better state of mind. Another good option to help yourself and others is reaching out to a professional. Going to see a therapist for the first time is scary and intimidating, but they're specialized in helping you through stressful times in your life. Each therapist will find the best treatment plan for your situation, which will make things less anxiety inducing and work towards finding a good balance in your life. And this is our work set page.